more nurses internationally, I'm focusing on international today, more international nurses are taking the NCLEX than ever before. And we have nurses that are coming from countries that normally did not even attempt to take the NCLEX. They just weren't, it wasn't part of their culture. Well, they're now taking the NCLEX exam. And out of the 22,000 nurses, 22,000 international nurses took NCLEX since January. So I'm talking about January, February, March. Just in 3 months, over 20,000 international nurses have said it's important to me to become a US RN. However, what the data showed is that even though this is one exam and everybody all over the world is taking this exam, there's different outcomes. And for international nurses right now, 1 in 2, if 2 nurses that are international go to take the NCLEX, one of them is expected to fail. That number is staggering for me because it did not used to be this way. It did not used to be this way. Actually, we're talking about a 13-point drop. The last time I was in Kenya and I was teaching, I was saying how the passing rate was about a 60% in Kenya, right? Passing rate was about, it was beautiful. It was like you're doing well. And this number isn't just reflective of Kenya, but it's reflective that there's a decline across the board. There's a decline across the board. So I want to get into actually showing the historic trend. You know, I love numbers. I'm a numbers person when it comes to NCLEX, right? Last year in 2024, in Q1, the passing rate for all international nurses was a 58%. Okay, a 58%. I'm talking about people who take it for the very first time and they go and they sit, it's about 58%. Q1 of 2025, there's been a slide down to 46%. That's a steep decrease, and typically you don't see it dropping by that. But even if we just look at the trends from the beginning of last year to where we are now, the number has been declining. The number has been declining. And so for us right now, this is a very sobering chart that we need to take our preparation serious and prepare the correct way, because where we will end up if nothing changes is the lowest NCLEX passing rate for international nurses in history. If this decline continues to happen, and I can't help everybody in the world, but I can help my ReMar nurses today. Okay. So I want you to really take what I'm saying and I want you to put it in your mind as law that you will not repeat the mistakes that are happening, because everything has already been researched, right? And so people that are operating without this knowledge are the ones that are perpetuating these mistakes. Okay. And so if we don't do anything, this is where we're going to head up. So this is the reality. More nurses are testing, but fewer of them are passing. And I'm not even going to keep y'all long because I think that the numbers will speak for themselves. If I just logged off right now, you would understand that we are in a very serious situation. Okay. So more nurses are taking it, fewer passing it. Let me stop and let me look at just country. Just look at country. Okay. And if your country is not mentioned here, group yourself with the nearest country that's closest to you. Here are the top 5 countries in 2025 who are passing NCLEX or not passing, I'm sorry, who are taking NCLEX. That's what I want to say. So what you see here is the 2025 rank from the largest to the smallest, largest being number 1, the country where they come from. We're looking at Q1 2025 results, the number of people. And then we're looking at Q1 of 2024, the number of candidates who took it. So of course, number 1 is the giant right? The Philippines, they usually send the most international nurses to take NCLEX. But look at the number. This year in Q1, 5,274 nurses attempted to take the NCLEX from the Philippines. Last year at the same time, they sent more nurses, 6,879 nurses. So we see a decrease in the Filipino nurses who are testing. They're not taking NCLEX at the same rate. There's been some confusion about what their career track should be. And so this number is actually declining, which it hasn't declined like this in quite some time. India, they're sending more nurses to take NCLEX compared to last year. Kenya, with the new testing center opening and a revitalization and opportunities. I told Paul, I'm blaming Paul for the increase in this number. I'm blaming Paul for the increase in this number because there have been, in the span of 1 year, so many hundreds more nurses from Kenya taking the NCLEX. This is not a bad thing. This is not a bad thing. Okay. We just want to make sure that these nurses are actually able to pass. They're actually able to pass when they sit. The same from Nepal. Nepal headed out pretty much about the same. The awareness is there. They have different challenges in Nepal and in India for passing NCLEX. I'll talk about that in a little bit. South Korea. Look at this. South Korea was not in the runnings at all in 2024. Not in the runnings at all to be considered top 10. Now this year, they have taken the spot of Ghana for top 5 countries. So Ghana last year sent 613 nurses. This year, I believe they sent about 620. So it wasn't enough to meet that top 5 score. And when I look at our countries, these top 5 here, I know the challenges that each one of them has. So I sat here and I wrote it down. The Filipino nurses, they typically do well, but they have this mentality that to study for NCLEX, you need to have a long process. They study way too long for NCLEX. They study years. They like this idea that you study for a long time. You're constantly studying. And so what that does is it decreases their ability to be able to just pull the trigger. So they struggle with double thinking. They struggle changing their minds, right? For India and Nepal, what did I have here? Pharmacology. They use totally different drugs and they struggle with their pharmacology understanding. Also, select all that apply questions are not something that they typically do. And so NCLEX is select all that apply. South Korea, the language. The nuances of American language is something that if you're not a native English speaker, you struggle with. Kenya, by far, the biggest barrier to passing rates in Kenya is access to technology, computer adaptive testing. The language barrier is not so much a challenge, but there are people who are preparing nurses for NCLEX that don't have the resources to prepare nurses for NCLEX. And so some Kenyans, some Nigerians, some people from Ghana, Ethiopia, they get caught into that trap that I'm about to address right now. Okay, so these are the top 5 countries that are taking the NCLEX examination from an international perspective. Right now, currently 1 and 2 of the nurses from international education will fail the NCLEX. Okay. Top 5 mistakes. And I used to do a different top 5 mistakes for international nurses. I've totally changed them because of this information. So I want to present how you are going to avoid these very real, very relevant mistakes. The first one is passive NCLEX preparation. I should say passive or free NCLEX preparation. There's no such thing. Preparing for the NCLEX is an investment. It is something that you have to invest in. And what happens is this, there is this there's this feeling that because you are binge watching YouTube videos or TikTok videos that you're being productive. But what's happening is the information is going in one ear and out the other. You have no retention. You have no active recall of the information, but it feels good. And I'm on YouTube twice a week, but when I'm on YouTube, I am drawing your attention to the material, because it's very easy to feel like just because you're watching a YouTube video, you're actually studying for this exam. And it's not the case. All right. So that's a huge, huge mistake we don't want to fall into. The second one is this: next generation NCLEX blind. Blind means you don't see it, you don't have it. Tutors and review companies. And these are people that are doing an old school NCLEX Prep. They have no technology. They have no technology. They have no system. And so what you find yourself doing is you find yourself listening to stories about how they passed NCLEX, right? And there's this mentality that because I passed NCLEX, I can teach you how to pass NCLEX. And that's how you get all these tutors now. That's how you get all these companies where the people are just telling you stories about how they studied, but they don't have a system for you to get into. They don't have any logic. They haven't written NGN questions. They don't know how they work. They don't know how they're scored. And so this produces unsuccessful candidates. And it's simply not because they're not smart enough. It's just because they haven't been prepared. So when we talk about training for the NCLEX exam, you must have access to that technology. Okay. Everything else is feel good activities. English Nuance. English Nuance is the idea that this exam is very much as much as it can be objective exam, but it's also very cultural. It's cultural to what is happening in America and also what's happening in Canada. So how we operate, how we center our patient care, how we speak about patients, the documentation, the English reading level. Okay. And so when you are overlooking these cultural nuances, and I don't have anything against international tutors or tutors that are international nurses, they don't come from America, they're not Canadian, fine. But you have to understand that these things must be incorporated into the training, or students won't get that. They won't be able to understand what they're being asked. There's a difference between highest and priority, right? That's a cultural nuance, the words that we use. They have to be addressed. Content confusion. And like I said, these are very simple things that can be fixed, but they continue to persist if they're not recognized. Content confusion just means this: you don't know what to study. So you studying everything. You studying what somebody told you they studied. You studied what, the books that's in front of you. You don't know. You're reading every book you got, trying to figure out what's on the exam. And so when you try to digest too much, even when you eat food, you eat too much food, you're going to get a stomach ache. You're going to start to get feeling sick. And that's what happens. That's what's happening right now. People are studying for stuff that will never be on the exam. Stuff nobody will even ask you on the exam. Yep. And remember, the thing about this is you cannot listen to somebody that said, when I took NCLEX, I had maternity, I had plasmapheresis, I had diabetes mellitus. And so you write those things down thinking like, yeah, that's on the NCLEX, not understanding that there's 10,000 questions in the question pool. And so what somebody gets on their exam, you may never see. And the stuff that you're going to see, you don't study. You don't study. So again, when we're watching these YouTube videos, when we're watching these TikTok videos, when we listening to people say what they got on NCLEX, you have to take that with a very small grain of salt, because your exam could be totally different. I'm talking about mistakes to avoid when you're preparing for this exam. The last mistake, the biggest one, is solo studying or directionless cramming. Okay. Solo studying is you studying without guidance, without mentorship. Almost impossible to do. Okay. As an international nurse, you need to have a pathway. You need to know, if I start here, I'm going to end up here. And that's why I love Paul's, he's laying out the pathway for you. You do this, you do this, you do this, you do this. He's telling you the steps. You have to walk in the steps. If not, you'll be walking in a circle, or you'll be waiting for somebody to tap you on the shoulder and say, hey, it's time to go this way, or no, it's time to go that way, right? This is the same thing with the V2 that we do. I want to make sure that when you start at pregnancy, you end up at prioritization. Those are the steps that you take to master this exam. And so all of these things can be very helpful for you to address, but you need to make sure you're addressing them all at the same time. Because if you fix all these 5 mistakes, then you can pass the first time. I'm not worried about anybody who is studying with me right now to fall into this. I'm not worried about that 46% passing rate right now, because I know exactly why it's that amount. I know exactly why it's that amount. We have companies reaching out to us that want to partner with us, and they're already doing NCLEX preparations, and they're telling us how they're preparing their students. And I know exactly what time it is for those students. Unfortunately, they won't pass NCLEX. They will not. We encourage you to pass the first time, because there's a lot of expenses in becoming a USRN. This can be a very reasonable expense, or you can incur all these hidden costs when you don't pass the first time. So of course, if you fail, you have to pay for the exam again. If you fail, you have to travel. You have to travel to the test site. You have to take days off of work, right? This also will delay your ability to be able to even come to the United States, because if you fail, nobody wants to talk to you. You have a much better chance when you are already a USRN to get a job as a USRN. And then there is this mental hurdle that you have to cross when you fail the NCLEX. You begin to have anxiety, right? You feel burned out. Is it even worth it? Then I see when you fail NCLEX, people deal with issues of the cortisol, the stress, right? The stress of even thinking about it. Cortisol is hard to get down when something is triggering it. And so we want you to pass the first time, not just financially, but mentally. It's a much better experience. So how do you do that? It's very simple. Let's fix all 5 of those things with one system, one training system. And it is the one that Paul is offering, especially if you're in African countries. You can have it all. Okay? It's going to address those mistakes that I just went over. In the V2 system, you're getting active learning, active recall, not passive. You're not just watching lectures. You are actually filling out the workbooks. These workbooks right here, I show them all the time. You're actually filling out the workbook. You have to do the work. This is active studying. You're actively studying. You're actively reading your material. Okay? Active. You have to have this part of your process. Watching YouTube videos is not enough. Getting into the Q Bank, you're going to get access to 4,000 NGN questions, 75 case studies, matrix, drag and drop, bow tie. You can't do NCLEX questions on the actual test day if you've never seen them before. And I know some companies can tell you, or some people may say you can do it on paper and pencil. You can do case studies on paper and pencil. We can send you a PDF of case studies. There's no such thing. That's not going to be an option for you. You must manipulate the technology before the test day. And really, you should spend about 2 weeks just doing case studies in the NGN question bank. You should at least give yourself at least 2 weeks of just doing practice questions, just doing case studies. And so if you get the ReMar V2 from Callion Nurse Consultants, they give you 6 months into my V2 system for you to be able to do those things, right? So that's what we're talking about. We're talking about the American language built into the system, the stems of the questions, the drills, the verbs, all those things are in. The videos are there. The study calendar is there. Everything. These are the mistake eliminators that I'm talking about. You can't go wrong if you are addressing these things. Somebody said, oh yes, the drag and drop took 30 minutes first try. Absolutely. If you don't know how to use those things, they take long. And that's one of the things, I don't know where you're from, but the nurses in Kenya, the research showed one of the things that they struggle with is time management. We're talking about time management during the exam, meaning you run out of time. You get 5 hours on the NCLEX. You run out of time trying to figure out what to do. So again, practice. How you practice is how you perform. How you practice, how you perform. So I'm so glad you came to this webinar today, because this is the thing. We're having these webinars every month. Every month we have the webinars. I just showed you what we're going to be talking about next month is just the self-care during the prep. And I don't even know. I might change that because I didn't expect to talk about this today. But we want to make sure that you are informed moving forward. So I see I have some questions. If you have questions about this process, because what I just did is I told you every reason why you should get started today. Okay. I showed you how to get started today, but you may have some questions about who to connect to. What's the next steps for you personally?